effort up to make today's health care vote a political issue well into the future. And joining me now, Representative Michael Burgess, a Republican from Texas. Good morning, Dr. Congressman. We should remind people you are a physician as well. Good morning.
Good morning to you. And actually, Dr. Poll's a good deal better than Congressman today, so please call me doctor.
All right, well, I will, doctor. Let's talk about why you're opposing the bill, because as a physician, you also are of the mindset that a third of doctors would retire if this legislation passes. I mean, is that what you really believe, or is that a bit of hyperbole?
That was a study done by a group called the Medicus Firm in December. Actually, they were looking at the question of the public option. If you leave the public option language that the House had in the bill, that figure was 45%. If you remove the public option language, that number fell to about 31 or 32%. And interestingly, of course, doctors have been have had a lot of trouble with the Medicare and Medicaid as far as their reimbursement rates. Those things are not improving. America's doctors are under significant amounts of stress. If the question is, if we put a bunch more insured patients in the system, can the doctors see them? I think the answer to that is yes. It may be difficult in some instances, but essentially doctors are seeing those patients today anyway, whether they're insured or not. But if you add to the load and you reduce the reimbursement rate, then the situation just reaches a breaking point that much more quickly, and doctors who are near retirement age say, I'm out, and even some that are nowhere near retirement age, or you wouldn't expect them to be near retirement age, also say, I don't think I can do this any longer.
Have Republicans lobbied some of these holdout Dems, these 10 to 20, depending on where the count goes, to remain against the bill? And if so, how do you do that?
Well, a lot of it is one-on-one. Of course, there are members of the Texas delegation who are, at least in the newspapers, undecided, and I do try to have candid conversations with those individuals. Our Texas Medical Association has come out strongly against this legislation as written. The Texas Attorney General, the Texas Governor, also strongly against this legislation as written. So I do try to make my case on a Texas basis with members of the Texas delegation who are either undecided or leaning yes. Otherwise, there are, just any number of conversations you have during the course of the day. Mr. Stupak and I sit on a committee together. We do interact from time to time, but the main lobbying efforts obviously come through leadership on both sides. Okay.
Let's get to what the Tea Partiers did. They apparently used racial and homophobic language against your Democratic colleagues as they passed a rally yesterday. Why haven't Republicans come out more forcefully to denounce that language? What's your reaction to that?
Well, first off, I spent a great deal of time on the lawn around the Capitol yesterday. I met a great number of good people who had sacrificed their own time and energy to be up here. Many were, in fact, out of work, but felt so strongly about this issue and loved their country so deeply that they were here. I do deplore the actions of the few who then cast aspersions on the larger group. That's unnecessary. Look, there are three major protests going on in Washington this weekend. You have the Tea Party protesters, you have the anti-war protesters down at the White House in downtown Washington, and today you've got the people who are anxious about immigration reform. Any two or three in any of those crowds could cast aspersions upon the whole group. There's no excuse for it, and people should actually just police themselves a little bit better. There's always, as I know, there's always a television camera, just a short period of way that can capture everything you do for perpetuity on YouTube.
Do you have an idea to what extent Tea Partiers do represent Republican ideals, though? Not those that were saying the racially and homophobic slurred language, which is just absurd, but the other part of it.
I think they'd be quick to tell you that they are not Republicans. They're grassroots conservatives. I think that is a good thing for our country. I obviously think it's a good thing for our side as well. Not everyone thinks exactly the same, but the principles and ideals that they most consistently espouse are ones that are fairly close to the ones that I believe in as well. You want a limited government, you want lower taxes, you want national sovereignty, and beyond that, let's talk about things. I'm there too.
All right. Dr. Michael Burgess, who happens to be Representative Republican from Texas, thank you very much for your time.
Thank you.
Good luck today.
Thank you.